Hi, I'm Tom Lynch. Two things. First, thank you for David Ting for the metal conversion project. More than 6,000 hours of physician time have been saved by putting medication lists into Epic in advance of go live, something we're very proud of. Speaking of medications, I'm with Eric Weil today. Eric, tell me a little bit about what we're doing in terms of the opioid crisis and the way that the MGPO and the MGH are responding to this problem.
So for the past several months, we have convened a group of stakeholders, physicians, anesthesiologists, pediatricians, general internists, surgeons, who are working together to develop a set of guidelines, strategies for the management and prescribing of opioid pain medications in the setting of acute pain and in the setting of chronic pain. Both of these strategies are going to be vetted by many groups at the hospital and then hopefully implemented as part of a broader education strategy.
Eric, is it our fault? What are we doing wrong? Or is it a question of education?
You know, it's not our fault, but we're contributors and we have to acknowledge that. We prescribe medications to patients and sometimes we don't put as much thought into the long-term downstream impacts. And so I think that there's a lot that could be done in terms of education to our providers, but also to our patients. And I think there's a lot we can do in terms of education around disposal of medications and around what they should expect just in terms of management of their own pain.
And Eric, prescribing is one part of it. What about treatment of substance use disorder?
So first, in order to acknowledge the management of chronic pain, we also have to have good systems in place to manage that pain. And so there's a component around pain management, but then there's also a very important component around the treatment of substance use disorders. It's a very significant issue in all of our communities, and we've taken steps across the MGH and the MGPO to develop programs to help manage substance use disorder within the communities, such as Revere, Chelsea, and Charlestown, and now on the main campus as well.
And that's a big part of the strategic plan of both the hospital and the MGPO. I'm Tom Lynch, and that's Two Things.